On ECG module part 3. In this video we will discuss about the P wave. In detail. So we already know P wave. P wave is the first wave of the ECG. So this is an ECG, P wave, Q, R, S and a T wave. In some cases there will be a mu wave. So this P wave we will take and discuss in detail. The normal P wave should be like this. If you divide it into two, the half of the part to even 2/3 of the part is contributed by the right atrial depolarization, and the remaining 1/3 is contributed by the left atrial depolarization. So the normal duration of a P wave is less than 0.11 second. If it is more than 0.11 second or 120 millisecond, this is equal to 2.5 to 3 small boxes, then it's called wide P wave. And the amplitude of a P wave, that is the height or the amplitude of the P wave, this is a tall P wave. So when do you call this tall P wave? So a normal P wave should be less than 2.5 mm or less than 2.5 small box. So anything more than that is called as an amplitude elevated or tall P wave. So this is a normal P wave. Thus this is a wide P wave. This is a tall P wave. And sometimes there are other abnormalities. Wide, normal. Then there could be like inverted P wave. Like this, in many cases there will be an inverted P wave, or there will be a biphasic P wave. Biphasic P wave. Then there could be multiple P waves. Like this, multiple P waves. So there are various causes of these abnormalities. So we will discuss each one in detail. First thing we will take about the P wave. So it could also be absent. Absent P wave. There are various causes of absent P wave. So yeah. So first we will discuss about the absent P wave. It is very important to know what are the conditions causing absent P wave, because most important reason for absent P wave is atrial fibrillation. There will be an ECG like this. There will be ECG like this. So the RR interval will be variable. There will be no identifiable P wave, or in fact there could be like fibrillary waves. So all these things are causes for absent P wave. Atrial fibrillation is one of the most important reason for an absent P wave. So next is atrial flutter. The atrial flutter is here the P wave is replaced by a flutter wave, because the heart atrium is contracting very rapidly like a flutter. The P waves are irregularly formed or like a seesaw pattern like this, and a QRS context like this, and a QRS context. These are seesaw waves or flutter waves. So third is SA block or sinus arrest. So we are coming to the order in terms of the most common causes. Most common should be the atrial fibrillation, next the atrial flutter, then the sinus block or sinus arrest, where P wave is not even produced from the SA node. Fourth could be nodal rhythm. So there will be abnormal P wave or small P wave, or sometimes absent. So this here the discharge is from the AV node. Then ventricular ectopic and ventricular tachycardia. These are also causes for absent P wave. Then supraventricular tachycardia, where the P wave could be hidden within the QRS complex, so that it is not visible in supraventricular tachycardia. And few other rare causes like hyperkalemia, there could be absent P wave, and accelerated idioventricular rhythm. So accelerated idioventricular rhythm is most commonly seen post MI hemoperfusion. Yeah, this is commonly seen. So these are the first and foremost causes for an absent P wave, where we don't see a P wave in the ECG. So next we will discuss about the tall P wave. So as previously discussed, a tall P wave should have an amplitude of more than 2.5 small boxes. mm or more than 2.5 small boxes. or small squares. So this could be a normal square around 5. So this P wave could be like this. Okay, this is a tall P wave. Okay, so costs. So with common sense and knowledge, we can say that a tall P wave is because of an atrial hypertrophy, preferably a right atrial hypertrophy, because the depolarization is so fast. So the right atrium wall muscle is thick, so initial P wave spike is very high, it is tall. Then it goes down like this. So this is a right atrial hypertrophy pattern or enlargement. So the most important cause for this tall P wave is the right atrial hypertrophy. So there could be small P wave also. So when you discuss a tall P wave, then we can also discuss about a small P wave. So P wave could be so small, I mean it's very small. So these are the causes. These are very causes for small P wave. So causes could be atrial tachycardia. So where the atrial muscles doesn't have enough time to repolarize, so the next repolarization of the atrium is producing a very small P wave due to tachy and reduced duration of atrial repolarization. Second is atrial ectopics. Third is nodal rhythm, where in high nodal rhythm or a nodal ectopic. In all these cases produce a small P wave. So next we will go into wide P wave. What are the reasons for a wide P wave? So a wide P wave is more than 0.12 milliseconds or 120 milliseconds. So this could be like this, or this could be like notched. So it is always more than 2.5 small millimeter or small squares, and more than 120 milliseconds. These are the criteria for a wide P wave. So this first and foremost causes the P mitrale. This is due to enlargement of the left atrium. So like this. So when there is a P mitral, or there is two different spikes in the P wave, this is mostly due to a left atrial hypertrophy or enlargement. So what could be a cause for left atrial hypertrophy? Like mitral stenosis, heart failure, preserved ejection fraction, diastolic dysfunction, long-standing AS. In all these cases, you have a left atrial hypertrophy or enlargement. So in these cases, produce a wide P wave. In V1 specifically, P wave may be biphasic with a small positive wave preceding a deep and broad wave, indicates left atrial enlargement or hypertrophy. So in V1, all V2 has a like this wave, whereas in V1 usually has a P wave like this. This biphasic P wave or an inverted P wave that is more than 2.5 mm amplitude is suggestive of a left atrial enlargement. These are soft markers of heart failure with preserved ejection fraction and ECG. Yeah. So next we'll go to notched P wave. Next we'll go to inverted P wave. So what are the conditions that can cause an inverted P wave? So first and foremost thing, it is normally inverted in leads L1, L2. It is normally inverted in leads other than lead L1, L2 and AVF. So you have to see only lead 1, lead 2 and AVF. So other sides there are normally inverted P waves. P wave is normally inverted. So only these leads you have to see for an inverted P wave. If there is an inverted P wave in these leads, it may suggest there could be incorrectly placed leads. Second is dextrocardia. Third is nodal rhythm, which produces a wave. Instead of SA node producing the impulse, AV node can produce an impulse causing this vector this direction, so it could produce an inverted P wave. And low atrial or high placed ectopic leads. these are the causes for an inverted P wave. So there could be other causes like variable P wave, which is a bit rare. So this indicates wandering pacemaker. What we mean with this variable P wave is that one wave is like this, other wave is like this, other wave is like this, other wave is like this. So these are all different types of P waves. So it suggests different areas of the atrium is producing an impulse. So passing vectors in this direction, this direction, this direction, this direction, this direction. So one P wave is not the same as other. It is also seen in multifocal atrial tachycardia, but most commonly seen in COPD and its exacerbations. So these are caused by variable P wave. And finally we have to discuss about the cause for multiple P waves. So when do we call this as multiple P waves is that when you have a consecutive 2 or more P waves. That's when you call this multiple P waves. Causes could be like AV block, either partial or complete heart block, where you get 2 P waves, then a QRS complex, sometimes 3 waves and a QRS complex. So there will be complete atrioventricular dissociation in case of a complete heart block. So there could be like ECG lead, there could be like P waves like this, many P waves, but the QRS complex in random locations. They are not in synchrony with the P wave. So this is one of the cause for multiple P waves. Second is supraventricular tachycardia with AV block. So SVT producing P wave in this rapid rhythm, but when there is a block into the AV node, there could be like 2-3 P waves, then followed by a QRS complex, 2-3 P waves, then followed by a QRS complex. This is one of the differential diagnosis of complete heart block, where complete heart block you get a bradycardia, whereas in SVT you usually get a tachycardia. These are the differences between the two types of causes for multiple P waves. So hope you learned a lot in this video about the P wave. I hope you have covered everything in the P wave scenarios. So the thing is, there could be absent P wave, there could be tall P wave, there could be small P wave, there could be wide P wave, and inverted P wave, variable P wave, and multiple P waves. So if you master this, I think you know everything about the P wave. So thank you for watching in this video. Do share and like and subscribe. This is Medicine Beyond Heresies. Let's meet in yet another video. Thank you very much.